Hello everyone, and welcome back to Balance My Hormones, where we break down health and wellness tips in a way that's simple and practical. In today's video, we'll be focusing on the quads or quadriceps as an injection site. The quads are a fantastic option for intramuscular injections, especially for those who prefer an easily accessible spot without needing assistance. So today I'm going to show you how to prepare your injection before we actually inject. And the injection will apply to really any ampule that you're trying to open. You may also be using multi-dose vials, but this video I'm going to show you how to open an ampule, and then we're going to progress into actually how to do the injection. Now, the one ampule that's quite tricky for some is how to fill a 1 ml syringe, so it's a 1 ml syringe, with 1 ml of solution. So if your injection requires you to inject 1 ml and there's only 1 ml in the syringe, you may wonder, how am I going to get it all in one? And I've got a trick to show you. So make sure you keep watching until the end and you'll see how I fill the entire syringe without getting any oil to spill out, which is important because whether you're doing Sustanon or you're filling 1 ml of a syringe for the propionate, testosterone propionate, or testosterone naphthate comes in 1 ml as well. In past videos, I mentioned when you, especially with a Sustanon ampule, when you open the ampule, look for the white, for the dot. But on this particular formulation of testosterone propionate, it doesn't have a white dot on it. So what I tend to do is I look at the writing and I always snap away. So regardless if you have a dot on your ampule or not, then I'm always still pressing away, breaking it away from me. So that's the key when you make this ampule. So how do I take the contents out easily? We offer at Balance My Hormones an 18 gauge with a filter in it. So there's an 18 gauge 1.5 inch needle. That's what these are. They have a filter in them, and then this needle over here in the middle is what I would use to actually do the injection. How to open the ampule. So essentially on this particular testosterone, I look at the writing, I hold the writing towards me, I grab it with, I'm right-handed, so I grab it with my left hand, I take my right hand and I put it on the neck of the ampule. Before I do that, I'll usually wipe off the ampule with an Elco swab, because sometimes there can be bacteria that sits in the neck of the ampule. So it's important to wipe it off. Not the end of the world, but it's just good practice to minimize any contamination. Okay. Also, if there's any residual liquid in the neck of the bottle, I would normally tap it to make sure none of it's there. Once it looks clear, as you can see, it's ready to go. Again, I find it better, regardless if the writing is towards you, if there's a dot towards you. It's always better to have the dot towards you if there is one. If there isn't, I like to look at the writing and put it towards me. But regardless, always snap it away from you. So what I mean by snap away from you is you hold it with your left hand, and with your right hand and your thumb, you put it on the neck of the ampule. You can hold your two fingers together like this, and then you just snap away. That was that simple. Now that that's done, you would get your needle and your syringe. Try not to touch any part of your needle or your syringe. Take it out of the packaging like that, and then connect them together. It's just, this one's a lure lock, or it screws on, so that's screwed on. Remove the cap. Now place the needle carefully inside, trying not to touch any edges. Now it's inside of the ampule, and now I'm going to pull out halfway. So as you can see on here, there's gradients. This is going to go to 0.5-ish, and there's also like a little bit of an air bubble. So halfway, good, that's done. I'm going to place the ampule with the remaining testosterone on the table. There's a little bit of it dripping out. I'm going to pull back on the plunger, but not too far, maybe to about 1 ml. And that will remove some of the extra testosterone inside of the needle filter. I'm going to make room for it. We'll push all the air out until I see a tiny little bit of a bubble of testosterone at the tip, and see if I can get rid of most of the bubbles. Maybe I'll pull back again. And this can always be a bit different, but more or less what I'm trying to do is make room for it before I fill it up the rest of the way. Okay, so now most of the air's out. I've gone halfway through. I'm at the halfway mark. I'm going to go back into the testosterone propionate, or back into the ampule. I'm going to remove the rest of the testosterone. Still, there might be a few bubbles, but I'm going to remove the rest of it until I get to about 1 ml. And I think I'm getting there. I'll go a little bit beyond the 1 ml. Be careful though, if you go too far, you will pull the plunger completely out. Okay, so that's should be most of it done. So you can see the plunger's at the end. If you pull back any further, really, you're going to reach a point where it may just end up falling out. So just be careful not to take it too far out. I'll tap it, make sure that there's no bubbles. I might even do it on the side. Okay, so at this point, it's going to be ready to have the needle that's going to be used for the injection. So this is my quad, so I'm making a muscle in my quad, so you can see we want to inject in this area here. Okay, and so by doing that, by flexing, I can kind of show you what the muscle group is. So I'm going to hit along this area. So I'm going to wipe it with an Elco swab and let it dry, otherwise it'll burn. Again, you might have your preference for where you inject. And sometimes you can get a little bit of bruising or soreness, depending on where it is. Okay, and now I take my syringe I prepared ahead of time. I'll make sure there's no bubbles in it. And flick off any bubbles, it's okay. I'm doing a smaller dose. Obviously, I pulled out 1 ml, but for demonstration purposes, I'm showing you less. And then I find the location. So try to relax. And we'll go along this strip here. You can see I'm pulsing here. It's a tiny needle. And then I hold it, and then I like to do it more slowly. I push it all in. Okay, and then I take my Elco wipe I've had, and I just replace the needle, and I put some pressure on it, and I'll hold it for a little bit so that I can avoid any bleeding. I just hold it. Sometimes I'll massage it a bit. Okay, and give it a minute, and there shouldn't be any blood, or very little, just a tiny bit. Okay, and then I'll take the needle and I'll put it in my sharp spin. I mean, if it's yourself, it's probably not a big deal to recap. If it's someone else, never recap. And that's how you do your quad injection. So hopefully you found that helpful, that you don't get a dead leg, because normally if you find the right location in the quad is notorious for having lots of vascularity, but it can also be an easy location for you to visualize and to see and feel a bit of a sense of control. So hopefully that helps, and you know how to do the injection properly. Thanks for watching Balance My Hormones. If you found this video helpful, please give a thumbs up, share it with a friend, and hit the subscribe button for more TRT and HRT insights. Explore our website at balancemyhormones.co.uk for our blood tests, our free testosterone calculator, and all the tools you need to take control of your health. Together, we're making hormone therapy simple, safe, and effective. See you in the next video.